This week's Ask Dr. Durie question concerns what is my perspective about the ongoing discussion about the costs of cancer drugs. Well, there was a recent excellent review in the Mayo Clinic Proceedings, of which Dr. Vincent Rajkumar was a co-author, which provides a very helpful overview of the different factors that contribute to the costs for cancer drugs. Obviously, the starting point for this discussion is that if the costs are sufficiently high and a patient is not able to have access to a drug, this is harmful for the patient. Not being able to get the drugs that a patient needs, this is something that is not good. So that the ideal thing, which is certainly something that all practitioners advocate for ethically, is that we need to be able to have patients take the treatments that they need. But the question is, how do we accomplish this? And broadly, at this point, with so many players involved, we need to be able to bring all the groups that have influence to the table. There are obviously the pharmaceutical companies, there are the insurance companies, there are medical practitioners, and then of course there are the patients who are ultimately the individuals who need to be considered the most. All the different parties involved in the healthcare providing system need to be involved to come up with what would be the best solutions. Now, in this particular article in the Mayo Clinic Proceedings, a number of suggestions are made. For me, at least, I'm not sure that these suggestions are immediately feasible in many cases. However, there are important ideas to put on the table. One which I think can move forward is to add value as an assessment tool within all treatment protocols. And basically this means that we would look at what is the cost of one treatment versus another if the outcomes are basically the same. And so that obviously if a treatment is working equally well and is much cheaper, this can be a preferred choice. And so organizations like the IMF and the International Myeloma Working Group can weigh in on these issues and help in the assessment of treatment regimens that might provide equal value but might be better within the healthcare system. Because there is no doubt right now that the healthcare system overall cannot handle the increasing costs across the board. If each new drug costs $100,000 a year, this is just not manageable. And so we do need to find a solution, because these drugs are not only being used individually, they're being used as combinations. 2 or 3 expensive drugs being used together to produce remissions. Well, this is fantastic, but it's just not manageable on an ongoing basis. And so my perspective is that this is a very important topic, one where we need to bring all the parties to the table and try to find sensible solutions that work well for everyone. We all need solutions. We all need to move forward in a positive way. But ultimately, it needs to be a system in which the patients do have access to the drugs and treatments that they need.